Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
What's up, guys, and welcome to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Cynthia, and happy Monday, everyone. It's a new week, new beginning. Let's set some new intentions. I know I say the same thing almost every week or every Monday when I record the episode, but that's really how I feel. Like, it's a new week. Let's set some new little goals, weekly goals, whether it be, to declutter a certain part of your house, or say you want to work out at least 3 times for this week, or whatever the case may be. The goal doesn't need to be anything major, but I feel like small wins keeps us motivated and going, right? I know it keeps me going. And my goal for this week, or my new intention, is to continue eating plant-based meals. So I talked all about it, beginner's guide to a plant-based diet lifestyle. I recorded that last week, so if you guys want to go check it out, go ahead and do so. I think it's really informative. I share with you all my personal experience being on a plant-based diet versus a vegan diet, which there is a difference, so I explain in great detail about it in that episode. And I feel good, honestly. Like, this is going to be I'm going to be entering my second week of eating plant-based meals. Prior to this little challenge I put for myself, the majority of my meals were plant-based. I'd say like 70 to 80% were plant-based, but I definitely had some room to cut back even more. And I did that last week, and I feel great, honestly. I do feel that the biggest challenge for me last week was that I went in not prepared in terms of, like, I think I should have planned out my meals a little bit better and been a little bit more organized with my meals in terms of, like, what I'm eating. So I was kind of like just putting random things together for some of my meals, and some of it worked out, and others I'm like, okay, this is a no-go. So honestly, that's the good thing about like health and fitness. There's a lot of trial and error, and especially when it comes to like meals and like whipping things up in the kitchen, whipping new recipes up in the kitchen. It's always kind of fun to kind of figure out what it is you like, what it is you're going to avoid from here on out. So I made like a really plain plant-based, whole food plant-based salad. I put kale, sweet potato, chickpeas, avocado, and I think I seasoned, the dressing was olive oil. And yeah, it definitely needed a little bit more flavor on my end. I felt like a cow grazing, grass in a lawn or something. I was like, this is not very tasty, but I know it's healthy. But that was just one meal, and I didn't remake that salad again. So I'm definitely learning, and I'm just excited for a brand new week. I'm definitely going in way more prepared. I listed out, what meals I'm going to be eating for breakfast, lunch, and dinner, as well as like a shopping list, so I'm going to go grocery shopping right after this, and I'm just going to be a little more prepared when I go in. So I'm excited. Anyway, with all of that being said, we're here to talk about acupuncture. And I've never gone acupuncture, but how I came across this topic was I have been looking, and I'm actually still searching for a masseuse or any type of massage parlor that's still open right now during COVID. And I found this place that's local to my area, and they specialize in acupuncture. Now, I don't think I'm like the right candidate for this. And again, we'll get into more details about what exactly acupuncture is. All I really knew was that they put like tiny needles in your body, and somehow I think that's supposed to relax you, and a whole bunch of other, benefits arise from doing acupuncture. So that's what we're going to be talking about in today's episode. We're going to be discussing how does it work, what are the benefits of acupuncture, what to expect, and some other home alternatives. So acupuncture is a form of alternative medicine, an alternative way of healing your body from the inside out, which that's another reason what really sparked my interest in acupuncture and in talking about it in today's episode. For all of my veteran listeners who've been tuning in to me for a few months now, you guys know that I'm a big advocate for holistic health and alternative medicine. That's what I personally believe in, and that's how I want to kind of deal with my health. I want to go that route. If you decide to go a different route, that is totally okay. That is your decision, but that's just kind of my take on, health and how I would like to prefer to heal myself. So acupuncture definitely sounds scary. I mean, even in the name itself, like acupuncture, like puncture, when I think of puncture, I immediately correlate that term with like lungs or ribs. I don't know. I feel like every time I hear that word puncture, I always hear ribs or rib cage in the same sentence. So it kind of freaks me out. So needless to say, it sounds scary, but there's proof it could help, and it could help a lot. So if you're new to holistic healing as a type of treatment, acupuncture can seem a bit terrifying, okay? So how exactly could pressing needles into your skin possibly make you feel better, right? Like, that sounds crazy. How does pressing needles into your skin make you feel better? And how does it not hurt? Well, no. It's definitely not the overly painful procedure you may be imagining. And considering that it's been studied and practiced for over 2,500 years, it seems acupuncture enthusiasts could seriously be onto something. Some people swear by acupuncture, citing it as a miracle to improving their quality of life because it's said to be able to treat everything from depression and allergies to morning sickness and cramps. So that definitely sounds appealing, especially to my ladies, morning sickness and cramps. Like, none of us want that. So if you listen to devotees, the prickly treatment sounds almost like a wonderful cure-all. But is it actually? So again, that's what we're really going to dive into in today's episode. So let's first discuss what is acupuncture. Acupuncture is an ancient Chinese medicine-based approach to treating a variety of conditions by triggering specific points on the skin with needles. Paul Kemptesi, he's a licensed acupuncturist with an MS in traditional Oriental medicine, explains that acupuncture is a minimally invasive method to stimulate nerve-rich areas of the skin surface in order to influence tissues, gland, organs, and various functions of the body. Each acupuncture needle produces a tiny injury at the insertion site, and although it's slight enough to cause little to no discomfort, it's enough of a signal to let the body know it needs to respond. And this response involves stimulation of the immune system, promoting circulation to the area, wound healing, and pain modulation. So contemporary research on acupuncture relies mainly on this theory. So you guys, we're going to cut into a very brief break right now. And when we come back, we're going to dive into what's the philosophy behind acupuncture. We'll be right back.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
What's up, guys, and welcome back to GSMC Health and Wellness Podcast. So, like I said right before we went on to break, we're going to be talking about what's the philosophy behind acupuncture. As I said, the response that's triggered from the needles pressing into your skin involves stimulation of the immune system, promoting circulation to the area, wound healing, and pain modulation. The Chinese philosophy behind acupuncture is a bit more complicated, as the ancient practice isn't traditionally based in science and medicine. They believed that the human body was filled with and animated by an invisible life-giving force, which they called qi. And it's spelled Qi, but you pronounce it as qi. And when the qi was flowing well and going to all the right places, then a person would experience a good mental and physical health. When the qi was flowing incorrectly or blocked or deficient, that would result in illness. So the concept of qi isn't too out there. Think of it as your body's natural inner workings, okay? Sometimes you're more prone to illness when feeling stressed or anxious. When you're relaxed and healthy, your body physically reflects that too, okay? So we have to remember that the mind and the body are connected. After all, your mood, mental health, and general well-being do affect your physical health. Thus, acupuncture aims to assist people in achieving balance, or as they call it, qi, and as a result provide relief for many ailments. So what does acupuncture do exactly? Who can it treat? You may be interested in acupuncture for a variety of reasons. For example, I personally sought treatment for, my chronic headaches and sinus pressure, as there are countless conditions and symptoms that acupuncture has been said to help with. So here are just some of the many claims. Allergies, anxiety and depression, osteoarthritis, chronic pain that's often felt in the neck, back, knees, and head, hypertension, insomnia, menstrual cramps and PMS, migraines, morning sickness, sprains, and strokes. And some studies even suggest that acupuncture can help with cancer treatment and multiple sclerosis. However, research for these conditions is limited and requires larger studies to confirm the benefits. So there is limited evidence that acupuncture can assist with acne, abdominal pain, cancer pain, obesity, insomnia, infertility, diabetes, schizophrenia, stiff neck, and alcohol dependence. While there's no evidence that acupuncture is a miracle cure-all, it does seem to have some evidence as a worthwhile treatment for people who may have multiple conditions and illnesses. There's a reason it's been around for more than 2,500 years, and as research grows, so will our knowledge of exactly what works and what does. So let's get into incorporating acupuncture into real life. For now, if you have a condition that acupuncture does have scientific backing for, here's what to expect from a session. An acupuncture session to last anywhere from 60 to 90 minutes, though most of this time may be spent discussing your symptoms and concerns with a practitioner sans needles. The actual treatment portion of acupuncture may last around 30 minutes, though you don't necessarily have needles in your skin for that long. In terms of results, it's nearly impossible to say what one should expect, as everyone responds to and experiences acupuncture differently, since everyone seeks acupuncture for different reasons. There is no universal response to acupuncture. Some people feel relaxed and may be a little tired. Others feel energized and ready for anything. Some people experience an improvement right away, and others, it can take several treatments before noticing a positive change. So it's different for everybody. With all that being said, though, what is the most common response to acupuncture? Because there is one most common response. And that is that people feel happy and content. It's hard to put into words, but there's a distinct balance and harmonious feeling that acupuncture gives most people, and it just feels good. You may also feel tired after a treatment and see changes in your eating, sleeping, or bowel habits, or experience no changes at all. So how can you find an acupuncturist? If you know someone who has had a positive experience with an acupuncturist, ask that person for a personal referral or introduction. I'd say that's usually the best way, as like-minded people often keep each other's company. And also, be sure to see a licensed acupuncturist. They should have LAC after their name. A licensed acupuncturist is required to pass the National Certification Commission for Acupuncture and Oriental Medicine exam or complete the NCCAOM program in the Foundations of Oriental Medicine, Acupuncture, and Biomedicine. Some certification requirements slightly differ by state, however. For example, here in California has its own licensing exam. You can also look online for certified acupuncturists in your area. So how much does a session cost? An acupuncturist cost? The cost of an acupuncture session depends on where you live and on whether or not the practitioner takes your insurance. For example, the UC San Diego Center for Integrative Medicine charges $124 per session without insurance. According to Thumbtack, a company that connects customers to professionals, the average cost for an acupuncturist in San Francisco is $85 per session. And the average cost of an acupuncturist in Austin, Texas and St. Louis, Missouri ranges from $60 to $85 per session. So what to do if there's no acupuncturist in your town or in your area? You should never try acupuncture on your own, right? You definitely don't want to try and stick needles in your skin by yourself or have someone who's not licensed to do it. Not only may it worsen your symptoms, that wouldn't be a good way to balance your chi. Instead, do Tai Chi, yoga, and meditation, and learning simple self-massage techniques to promote the flow of energy into your aroma and different parts of your body. If you're looking for ways to gain similar benefits at home, pressing these points is known as acupressure. Lisa Chan, licensed acupuncturist and certified reflexologist, provided some insight as to which points on your body you can massage on your own. If you're experiencing menstrual cramps, for example, hold the hollow of your inner ankle with your thumb using little to no pressure. And this covers points K, 3, 4, and 5. If you're having trouble sleeping, rub in circles the yin tang located between the eyebrows going clockwise, then counterclockwise. To help ease lower back pain, Chain recommends pressing Do26, the space between the middle of your nose and upper lip. And I'm literally doing it right now because I seriously have lower back pain from my lower body workout session earlier today. So I'm going to stay holding and see if that helps. The most popular pressure point is the LI4, which is a large intestine 4, and for good reason. Pressing this point located on the muscle between your thumb and index finger is meant to help alleviate headaches, toothache, stress, and facial and neck pain. Don't press this point if you're pregnant unless you're ready for labor. In that case, it can help induce contractions. So unless you're trying to get that baby out, then, hit those pressure points. So again, those acupressure points, I'll review them again because I know some of you are going to want to try them at home. So for menstrual cramps, massage the hollow of your inner ankle with a little pressure. For insomnia, rub clockwise, then counterclockwise circles in the spot between your eyebrows. For lower back pain, press the space between the middle of your nose and upper lip. And for general headaches, try pressure on the muscle between your thumb and index finger. So you guys, I'm going to come to a very brief break. And during this break, I hope you guys are doing one of these acupressure points. I'm going to do the one for my lower back pain, which is pressing the space between the middle of my nose and upper lip. So I'm pressing. And when we come back, we'll talk more on acupressure points and acupuncture.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
What's up, guys, and welcome back to GSMC Health and Wellness Podcast. So again, I hope you guys were holding on to those acupressure points. And I think mine may have helped a little bit, not even lying. Like I was holding that space between the middle of my nose and upper lip. And I'm not even kidding you guys. I think my lower back pain is a little bit put at ease. So this is actually amazing. I may have to continue holding this pressure point for a minute. So if you're unsure of how or where to start, consult with a certified reflexologist or acupuncturist. A professional can demonstrate where and how to apply pressure properly. Acupuncture is recognized as safe and beneficial for many conditions, but it's not a cure-all for everything. You should still be taking your medications. But while it may eliminate your symptoms, it could still ease them. So it may be worth a try, especially when it comes to chronic pain. And if you're still skeptical, talk to your doctor about your concerns. They'll look at your symptoms, medical history, and overall health to determine if acupuncture is right for you. So I want to try it. I just don't know if it is, the absolute best thing for me. You know what I'm saying? So I don't know, but I still want to try it because I feel like if I don't ever try it, I'll just never know, right? So that's my thought process. We're now going to be diving into acupuncture, specifically for headaches and migraines. I know many of you get these, especially if you got kids. No, I'm kidding. But I know many people of the population, experience headaches and migraines from time to time. Life's crazy right now. There's a lot going on. Who doesn't have a headache from time to time? Again, acupuncture is a component of traditional Chinese medicine. It involves inserting very thin needles into pressure points on your body. The medical community's research and opinion on acupuncture is mixed. Some studies point out that sham, also called simulated acupuncture, works just as well as real acupuncture. Other studies affirm that acupuncture can give relief to people that experience chronic headache pain. The World Health Organization has endorsed acupuncture as a promising treatment for pain since 1979. Acupuncture seeks to restore the flow of positive energy throughout your body. It also claims to remove negative energy that is causing you pain. From a modern medical perspective, acupuncture stimulates various symptoms of your body, and this may trigger a healing response. Acupuncture divides your body into a series of zones and pressure points. Acupuncture needles are inserted into different pressure points depending on your symptoms, and these needles are usually near nerves in your body. The needle stimulates the nerves to release hormones, such as endorphins, that trigger a response from your body. This immune and circulation system stimulation is what proponents of acupuncture claim relieves migraines and tension headaches. So what are some of the risks and shortcomings for headaches? Acupuncture itself carries little risk when done by a licensed practitioner. Sometimes bruising, fatigue, and soreness follow an acupuncture appointment, especially after your first time. According to the National Centers for Complementary and Integrative Health, acupuncture that is performed with substandard or dirty equipment can pose a very serious health risk. And I can totally understand why. That is disgusting if someone puts dirty needles into your skin, right? Nobody wants that. Acupuncture needles are regulated by the U.S. Food and Drug Administration and are supposed to be single-use only. And I would hope so. So make sure to do your homework on your acupuncturist before booking your first appointment. And leave the appointment if you don't feel comfortable. Watch your practitioner to make sure that the needles being used are sterile and new. Don't be afraid to ask questions about what is going on. A good acupuncturist will walk you through the procedure and make sure it's a calm and safe experience for you. Acupuncture by itself might not be enough to treat chronic pain. Migraines, tension headaches, and cluster headaches that impair your daily life should be addressed with pain medication. So here are the general guidelines for acupuncture. There's no special preparation prior to an acupuncture treatment appointment. If it's your first time, you may want to go with a list of questions. Your practitioner will be able to advise you how many treatments you should expect and how often you might need to go to experience relief of your symptoms. A clinical study of acupuncture for cluster headaches recommended treatment twice a week for 2 weeks, followed by 1 treatment per week for 8 weeks, and maintenance treatments of once every other week after that. Some people do feel tiny pricks when the needles are inserted for acupuncture treatment, and some people won't feel anything at all. If you speak with your practitioner about concerns you have about discomfort, you might feel calm going into the procedure. You should be aware that many insurance companies don't cover acupuncture procedures. Find out the cost that you will need to pay out of pocket before you try acupuncture to relieve your headaches. So here are some other alternative treatments. If you're interested in supplementing or supporting your headache treatments with holistic medicine, there are options besides acupuncture. Essential oils and exercise might bring you pain relief. Lavender oil has been studied and found to be an effective and safe treatment for acute headache pain. Studies suggest adopting an aerobic exercise regimen might be another option. Exercise may improve circulation, relieve stress, and increase lung capacity, among other things. People with migraines are often encouraged to adopt an aerobic exercise routine as a way to counteract the cause of their symptoms. So when should you see your doctor? Acupuncture can't take the place of traditional medicine. Some headaches require immediate medical attention, and you should try to treat them with acupuncture. So again, speak to your doctor if you're experiencing loss of vision, dizziness, or nausea. Headaches after a blow to the head, headaches that keep getting worse, and unusually severe headaches can all indicate that you might need immediate emergency attention. Sometimes headaches can be caused by underlying factors such as blood pressure spike or an allergic reaction that need to be diagnosed. Always remember to tell your doctor about alternative medical treatments that you're receiving for an established diagnosis. I mean, that is always the smartest, way to do it, right? Talk to your doctor about your symptoms. Make sure that it is the right path for you. I mean, I think I've said this multiple times, that just because something is, alternative medicine or holistic or non-invasive doesn't always necessarily equate to the best option for you. Like I said in the very beginning of today's episode, I want to try acupuncture, but I feel like the symptoms that acupuncture is said to relieve may not benefit me. I just want to kind of relieve my body aches. I don't have chronic pain, but I do get body aches, from lifting heavy and lifting frequently. So I was looking at acupuncture as an alternative for me to kind of relieve that pain. And also just something, I'm very open to anything in the health and wellness game and fitness game. And any treatment I want to try. It's kind of a good thing, but it's also bad because, again, the treatment may do me more harm than good. And so I just always have to be careful when, talk to my health care provider and to ensure that my symptoms could be relieved through acupuncture. And based on what we've been talking about in today's episode, I'm not 100% sure that may be the case. I don't really have very severe symptoms. I just have minor aches and pains from lifting. So I think for me personally, I would probably go with a full body, sweetest massage. And that sounds amazing. So that will be another discussion for a different day. So we're going to cut into a very brief break, you guys. And when we come back, we're going to talk about acupuncture and how it may be effective at reducing indigestion symptoms. We'll be right back.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Hey guys, and welcome back to GSMC Health and Wellness Podcast. So we'll now be diving into acupuncture and how it may be effective at reducing indigestion symptoms. Researchers in China say acupuncture can help people who have a common form of recurring indigestion. They report that study participants with postprandial distress symptoms, PDS, saw relief from symptoms after a 4-week course of acupuncture. Experts say acupuncture works on this type of indigestion by manipulating the flow of energy through the digestive system. A pin, rather than a pill, could help those living with the most common form of recurring indigestion. Researchers in China say a 4-week course of acupuncture appears to relieve symptoms of postprandial distress syndrome, a form of indigestion characterized by early fullness after eating and upper abdominal bloating. In Western medicine, PDS is usually treated with antacid medications such as Tagamet, Pepcid, and Axid. But researchers from the Beijing University of Chinese Medicine say acupuncture could be a safe and effective alternative. In a study published in the Annals of Internal Medicine, 278 study participants with PDS were given either 12 sessions of acupuncture over 4 weeks or received sham acupuncture. The study found that participants who received actual acupuncture were significantly more likely to report improvement or extreme improvement in their symptoms. Acupuncture participants were also more likely to experience complete resolution of their symptoms. So let's talk about the study by the numbers. Researchers studied the effect of acupuncture on 3 main symptoms of PDS: post-meal fullness, upper abdominal bloating, and early satiation. They reported that 83% of participants in the actual acupuncture group reported a positive response from treatment versus 52% in the sham acupuncture group. All 3 symptoms were eliminated among 28% of the acupuncture group compared with 18% of the control group. Improvements were sustained for at least 12 weeks after the final acupuncture treatment, according to researchers, and there were no serious side effects among the study participants. Dr. Kirsten Tillich, a gastroenterologist and professor of medicine at the University of California, LA, told Healthline that the study is the latest research showing effects of acupuncture on the GI tract, including successful treatment of constipation. Most studies looking at GI symptoms have been small, though, so it is helpful to start seeing large clinical trials with randomization and a control group. It would be even better to see a comparison to usual medical care as well. So again, this is how it works. Jamie Bacharach, a medical acupuncturist at Acupuncture Jerusalem, told Healthline that gastrointestinal issues trail only pain among the reasons that her clients seek acupuncture. A lot of people come in with similar symptoms of PDS, she said. Western medicine often doesn't do well with these conditions. According to Bacharach, acupuncture manipulates the flow of energy along the meridians of the body and get it moving in the direction it is supposed to be going. Just as gastrointestinal disorders may be seen as problems with the movement of food through the stomach and intestines, she says acupuncture seeks to address the counterflow of energy through the body. In Chinese medicine, stomach energy needs to move downward through the digestive tract, said Cao Lin Moy, who was a licensed acupuncturist, an expert in alternative and Chinese medicine, and founder of Integrative Healing Arts in New York. If there is something moving upward, then the qi, life energy, is rebelling and it needs to be balanced. The mechanisms by which acupuncture works are not completely clear and are likely multifactorial. There is evidence that it acts on the autonomic nervous system, in this case the vagus nerve, and this may alter stomach motility and relaxation. Acupuncture also likely has effects on pain processing at both central and peripheral levels, she said. Finally, there is a high placebo response to acupuncture, and even in a controlled trial, the subtle differences in how the needles are placed and manipulated could have biased the response somehow. Acupuncturists may treat conditions like PDS, by inserting needles far from the source of the problem. There are a couple of acupuncture points on the outer calf between the knee that are really great for digestive issues and on the inner wrist for abdominal fullness. Other practitioners, however, would prefer to go straight to the stomach. Past studies, some from the same group of researchers, have also found promising results using acupuncture to treat indigestion. The American College of Physicians noted in a statement within this week's study that the findings were particularly significant because of its size and structure. Other recent research has found that treating the digestive disorder with turmeric yielded similar results to treatment with simethicone, the main active ingredient in drugs such as Alka-Seltzer, anti-gas, and Melanto-Gas maximum strength. Dr. Tillish says PDS can lead people to avoid meals, restrict their diets, and even lose weight unintentionally. The cause is not clear, but it appears to be related to a disturbance in the brain-gut axis, possibly related to the way that the stomach moves in response to food. Most commonly, people are placed on a medication to reduce acid, like a proton pump inhibitor, to see if this is effective. Others may use herbal treatments like Enera-coated peppermint oil or other herb combinations. Others may respond to dietary interventions, antidepressants that alter pain processing pathways, or use mind-body interventions, which, like acupuncture, target the autonomic nervous system and pain processing in the brain. Pretty interesting, right, you guys? You know, how acupuncture, how the act of sticking needles into your skin can produce all of these like results and can ease pain. It's really, really crazy. And, you know, this ancient form of alternative medicine is growing in popularity as a viable treatment for a range of conditions. And, you know, we're going to right now get a little bit into how, you know, why people are choosing acupuncture over opioids for pain relief. In the midst of the opioid crisis, acupuncture has been growing in popularity in the United States. Primarily used for pain management, this ancient Chinese form of alternative medicine, which involves thin needles being inserted into the skin, has gained support from the U.S. Department of Veterans Affairs and Medicaid as a viable treatment in recent years. While the scientific evidence of acupuncture's benefits is still widely debated, research from key Western studies suggests it can be used to manage certain pain conditions, especially back and neck pain, osteoarthritis pain, and headaches. It's also been used to treat a range of other conditions. As its popularity has grown, more people in the United States have begun turning to acupuncture when conventional medicine falls short. Researchers are still trying to determine whether acupuncture can be a beneficial treatment for various health ailments. However, for those who may be seeking alternative options for hard-to-treat conditions, here are 4 areas in which acupuncture may help you guys. So we'll discuss those 4 areas right after this commercial break.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
guys, and welcome to GSMC Health and Wellness Podcast. Well, welcome back, right? Because I know you guys have been hanging out here for a minute. So, like I said right before we went on to break, we're going to be talking about the 4 areas in which acupuncture may help. So, acupuncture for easing pain, right? Heidi Boyson has suffered from chronic low back pain for a decade when she tried acupuncture for the first time in England. She'd already tried chiropractors, physical therapy, and medication, and she said that nothing worked. The acupuncturist put needles in my head, and I fell asleep, which was great. When I woke up, I was much more relaxed, she said. After just one visit, Boyson says her pain became manageable. Western research has shown that acupuncture can be effective in managing pain. Exactly why it works is still unclear, though there are several theories. The first written account of acupuncture in the Yellow Emperor's Classic of Internal Medicine dates to 100 BC in China. The theory behind the practice suggests the stimulation of specific spots prompts the body to release a flow of energy, or qi, which travels through meridians. The Western explanation: the needle stimulates a nerve, which sends a signal to the brain to release beta endorphins. And these chemicals work as the body's own opioids, lowering pain thresholds. Another theory proposes acupuncture changes cells and connective tissue around the pressure points in lasting ways that lead to less pain. There is also evidence, according to a 2016 study, that stimulating the vagus nerve, which runs from the brainstem to the colon, may lower inflammation throughout the body. Inflammation is closely tied to chronic pain. States looking to cut opioid prescriptions have been experimenting with extending Medicaid coverage for acupuncture as another option for pain treatment. Rhode Island, Oregon, and Ohio all have programs that extend coverage in part. When Vermont commissioned a small pilot study on acupuncture for chronic pain in its Medicaid population, it concluded that 32% of people taking opioids for pain cut back. They were eligible for up to 12 treatments over 2 months. The U.S. Department of Veterans Affairs has trained more than 2,800 providers of battlefield acupuncture, a protocol that involves the ear to relieve pain. According to Dr. Charles Levy at the Gainesville, Virginia Center in Florida, the protocol has helped with headaches, acute and chronic back and musculoskeletal pain, and neuropathic pain. The result depends dramatically on the pain, the practitioner, and the patient. Last year, when Boyson was coping with occasional migraines, she went to an acupuncturist in New York City. Traditional medicine wasn't helping, and the acupuncturist was lovely and affordable, she said, adding she'd feel good after each visit, but this time the effects didn't stick. The Cochrane collaboration looked at 7 studies that compared the effect of acupuncture against a sham, a placebo acupuncture procedure, to treat tension headaches. The group that received the sham placebo procedure had headaches 7 to 16 days a month, while those who had the real acupuncture suffered 2 fewer days with headache. Everyone had a minimum of 6 weekly treatments. Narda Robinson, an osteopath who uses acupuncture, says that when she treats headaches, she does a careful examination of not only the patient's head, but also the neck and back and the patient's posture. She goes, I am accustomed to whole person medicine, not focusing on one part of the exclusion of others. So, treating neurologic injury. Robinson, who runs Cura Core Integrative Medicine, an education center in Fort Collins, Colorado, is also a veterinarian. She's seen acupuncture work wonders with both people and dogs suffering from nerve damage. Stimulating acupuncture points in dogs with paralyzed hind legs has allowed them to walk, she says. My veterinary colleagues and I witnessed remarkable turnarounds in dogs with thoracolumbar spinal cord injury from disc disease, she said. Another remarkable turnaround happened to an environmental scientist in his 50s who came to see her for acupuncture. Because of a car accident 20 years earlier, he couldn't fully smile on one side of his face or clearly pronounce words. His face, hands, and feet were numb. Soon after she treated him, he began to regain sensation and motor skills he had been told would never return. At every visit, he'd report how he could now feel the fine edges of the computer keyboard, use his fingers well enough to button his own shirt, and smile as well as speak normally. Can acupuncture reliably help serious neurological problems? It's certainly something that should be explored more intensely in human spinal cord injury clinics, both to facilitate recovery and reduce the need for surgery. However, the research so far has been mostly inconclusive. A 2005 review of using acupuncture to recover after a spinal cord injury found only 12 studies which did show improvements in motor function and functioning. Yet, a 2018 review of whether acupuncture helps stroke survivors found more than 30 studies on the subject, and it was inconclusive. Nevertheless, Robinson strongly disagrees. She maintains that the evidence is promising enough. She believes people with nerve damage should be offered acupuncture, especially if they have fewer options. The same reasoning might apply to hard-to-treat pain. In 2018, 4 U.S. anesthesiologists conducted a review of non-drug treatments for fibromyalgia, which is a condition marked by fatigue and pain in many spots of the body. They concluded that meditation and cognitive behavioral therapy were more promising than acupuncture. Because it rarely causes any harm, they wrote it also should not be discouraged. So let's talk about acupuncture in terms of promoting weight loss. New strategies to lose weight are usually a fad. There is no gold star research, large controlled randomized studies to support a case for acupuncture to shed pounds. However, there is some early positive evidence. 2 points in the ear have traditionally been associated with appetite. A 2017 review found 18 randomized controlled studies of ear acupuncture for weight loss. These were small studies. The largest study only involved 200 participants. The review concluded that ear acupuncture was linked to an average loss of about 3 pounds. Treatments that lasted longer than 6 weeks produced the best results. A number of studies are being conducted with the effect of a person's microbiome, the bacteria inside the body, on weight gain. A small Shanghai study found that acupuncture reduced the number of bacteroids, which are more abundant in those who are obese or overweight. Despite the widespread use of probiotics, we don't currently have targeted ways of changing our gut flora. In this study, among the 30 women who received the acupuncture, the average BMI dropped from close to 28 to a little over 25. The bacteroids levels also fell. A small control group didn't lose much weight or see the same favorable changes in their gut flora. There is some data suggesting that electroacupuncture is more effective than needles alone for weight loss, according to another 2013 review. Acupuncture may reduce inflammation, which is related to obesity as well as pain. If it relieves pain or anxiety, that could help people avoid overeating too. I don't see acupuncture as having that big and effective obesity itself, but more on addressing problems with pain and mood. And lastly, let's talk about acupuncture in terms of taming nausea. According to a 2017 review, the National Cancer Institute, and other major medical organizations in the United States and Europe regard acupuncture as an appropriate treatment for post-chemotherapy nausea and vomiting. A systemic review of 30 randomized and controlled trials involving more than 2,500 volunteers concluded that stimulating various acupuncture points cut nausea and vomiting within hours or a day after surgery, which is a common reaction to anesthesia. And I wouldn't know because I've never, gone under or had, gone to sleep under anesthesia. So the National Institute of Health supports research on acupuncture as a treatment for a range of conditions, including hot flashes, pain related to chemotherapy, and tinnitus. The opioid crisis has also restored interest in acupuncture, not just for pain relief, but also for relaxation to help wean people from addictions. More research is needed to fully understand all the benefits acupuncture might offer. Until then, people seeking alternatives for hard-to-treat conditions may find relief through this Eastern approach to medicine. Conventional medicine is not at crossroads. The drugs and surgery-dominant approach to pain is costly and incomplete, and patients end up misdiagnosed and over-medicated for problems medical acupuncture could help. So you guys, that's going to wrap up today's episode here at the GSMC Health and Wellness Podcast. I really hope you guys enjoyed today's talk in regards to acupuncture. Please let me know in the comments if you've tried it before. And I would love to hear from you, your experience, if you liked it, what are your recommendations, and so forth. So if you enjoyed today's episode, please don't forget to like, share, subscribe, comment, all of that good stuff, because that tremendously helps the show. And I'll catch you guys here for the next one.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.